Thank you for your interest in our PGY2 Pharmacy Residency Program in Ambulatory Care at Virginia Mason Medical Center in Seattle, Washington. As a second-year resident, you will have the opportunity to practice as a provider in both our primary care clinics as well as several specialty clinics. Our residents are mentored by pharmacists that each have their own robust clinic practices. Residents work both in our downtown Seattle campus as well as spending time at some of our 8 regional medical centers. Throughout the year, our residents focus not only on fine-tuning their clinical knowledge, but also on skills like innovation, lean methodology, and change management.
So I'm able to practice at the top of my license by managing a full patient schedule, ordering labs and medications under my own name, and also providing curbside consults to providers and nurses in the clinic. Also, I'm able to complete projects and rotations that I'm passionate and interested about, since it is more specific to ambulatory care.
Being a PGY2 at Virginia Mason is more than just the mentorship and the great rotations that we have. That's one of the obvious perks. But as well as that, I have gotten to meet so many different people, different providers and team members, especially our folks down in the cafeteria. That's one of my favorite perks is our meal stipend that's offered as a resident here. It's a small thing, but it has gone such a long way in my quality of life as a resident, having some free lunch. One of the other perks that has meant a lot to me, it's again pretty small, but having my own office space and my own computer has been really important for me. We started the year with a mindfulness coach and learned a lot of tools and management strategies for stress and all the things that residency year throws at you. And then on a personal level, that has provided me with tools to get through some of the stressful times of this year, but then also interact with my patients in a more positive way. As well as that, it's a good opportunity to get to know my PGY1 and PGY2 co-residents, and we have a lot of bonding moments and form friendships through this.
There are many things I enjoy about Virginia Mason. I've been at Virginia Mason for over 18 years, and I've enjoyed my time immensely here at Virginia Mason. I am able to practice at the top of my license. I'm able to prescribe within my scope of practice for the patients I take care of every day. So the second reason I love Virginia Mason is the team-based approach that we have with the doctors. We can always come to them and they can come to us, and they respect our recommendation. Getting that respect from the doctor is so important for me because it gives me that job satisfaction, knowing that I made a difference, not only with the doctors, but with the patient. I enjoy precepting so much. It is my passion at Virginia Mason. I enjoy getting to know the residents, giving them the tools to excel and learn and become a polished clinician by the end of the year. I enjoy seeing that maturation process for the resident from the beginning of the year to the end, seeing the growth in their development. It is such a worthwhile experience that I can't imagine doing something else but being a preceptor for residents.
So currently, I am a clinic pharmacist provider at multiple primary and specialty clinics here at Virginia Mason, and I would say that my PGY2 residency experience prepared me very well, not only to be an astute pharmacist, but also an effective clinic pharmacist provider. During my residency experience, I was challenged to manage clinic autonomously, sometimes seeing 15 to 20 patients a day. I was challenged to think on my feet continuously and to really navigate through the gray areas of clinical pharmacy with grace. And I was able to do so under the wings of really seasoned preceptors who have been doing this for many years. Today, I am proud to say I'm a confident clinical pharmacist provider, and I owe it to this residency experience, and I don't think I could have gotten this residency experience elsewhere. It was rewarding not only to build sensible treatment plans for my patients, but also really getting to know them, about their families, their values, and even their favorite sports. So I would say that was one of my favorite experiences, and it really solidified during residency, why I enjoy ambulatory care and why this is truly my passion. I would say that the support that I got as a resident would be one of the biggest highlights of my year. I will start with my preceptors by saying that they were very well invested in my growth as a learner, Even after the rotations ended, I kept in close touch with many of my preceptors and learned a lot of tips just about being an ambulatory pharmacist. My RPD and I met weekly to touch base about my development, how rotations are going, how project management is going, and I never once felt shy about speaking up about whether I felt overwhelmed or needed additional support. I also had 3 amazing co-residents, and we were able to bond in the beautiful city of Seattle and through the many wellness initiatives that our residency program embedded for us. So I would say I felt very supported here as a PGY2 resident.
There are so many things about Virginia Mason that I think make it unique. For me, when I came here, I was attracted to it because of its national reputation for quality and safety. And when doing my research, I found out about our world-class management system, which is also called the Virginia Mason Production System, that is really unusual. We have taken technology from Toyota using their lean technology and management system and have implemented that lean approach to healthcare. I think this is really exciting. It gives us the tools to solve any problem. It makes us innovators, and I think it allows us to work on that quality and safety that brought me here. Virginia Mason is known for being team medicine, and our pharmacists are recognized as providers on the team like any other advanced practitioner. We are seen as equivalent with the other physicians, our nurse practitioners, our physician assistants. We are seeing patients independently, we are billing, and in Washington we're known for our progressive practice model.
Thank you for your interest in joining our team. We think you'll find that Virginia Mason is a very special place to train and practice.